If you've ever had to go to the bathroom and can't, you're in the middle of an important business meeting or stuck in rush hour traffic, then you know the anxiety and embarrassment that urinary incontinence can bring. For you, those feelings only lasted as long as the situation. For those who suffer with urinary incontinence on a daily basis, it's a constant worry, and it can occur when they least expect it.
Urinary incontinence is an involuntary leakage of urine, which in layman's terms is basically the leakage of urine without wanting to urinate. Urge incontinence is a leakage of urine with an abnormal urge to urinate. It's basically that their bladder is not necessarily full, but it's telling them that they have to urinate. And the wait time, basically the time it takes for them to get the urge to the time that they can make it to the bathroom, is significantly decreased. Stress incontinence is leaking when you have any kind of pressure on your abdomen. So when you laugh, cough, sneeze, you leak urine.
Urinary incontinence is common in many women, so common in fact that many think that incontinence is a normal part of aging. It's not, and no woman has to accept it as part of life. It can be prevented and treated.
The leakage is caused by a lack of control of your urinary sphincter. When you laugh, cough, or sneeze, your body involuntarily closes the sphincter, which is the opening that allows the urine to come out. However, in situations where this muscle and fascia is weak, you're unable to really close that sufficiently, and therefore you leak urine. This occurs often after multiple pregnancies, after a difficult delivery. It also sometimes occurs after pelvic surgeries, or it can be caused by pelvic radiation. The urge is coming from an abnormal sensation in your bladder, and it's usually part of a complex called overactive bladder. But sometimes it may also be caused by a urinary tract infection or, on rare occasions, bladder cancer.
Another risk factor is aging. The muscles of the pelvic floor weaken over time, providing less control.
So when a person comes and sees me, I do a full history and a physical, which includes a pelvic exam. And the pelvic exam basically tests the pelvic floor musculature. Also during the exam, I'll ask a person to laugh or cough and see if when they do this, there is any leakage at that time. If I don't see any leakage, the next test would be a urodynamics test, which is a test that basically simulates when a patient's bladder is filling and when it's emptying, so I can see what happens during their normal day. I will ask more about neurologic issues and history of diabetes, because these two can lead to urge incontinence.
There are many, many different treatment options for urinary incontinence. They typically fall into two categories. The first category is non-surgical, which is primarily lifelong maintenance of the condition.
So treatment options include pelvic floor physical therapy, or Kegel exercises. So Kegel exercises is just a strengthening of your pelvic floor muscles. And if you do pelvic floor physical therapy, that is a therapist helping you to figure out what those muscles are and to target those muscles in order to help strengthen them. Medications such as anticholinergics and a new medication group called beta-3 agonists basically help quiet down the bladder to give a person about 30 more minutes to make it to the bathroom. There are other treatments that can be done to help to improve incontinence symptoms. These treatments include Botox, which is similar to the medication that people use on their face for wrinkles. And basically what that does is it numbs the bladder muscles so that they don't contract as frequently. Another treatment that we sometimes do is what we call percutaneous tibial nerve stimulation. And basically, in layman's terms, that's an acupuncture-like procedure where we stimulate the tibial nerve, which sends messages to the bladder. And after about 12 weeks of treatment, you have a significant improvement of your urgency and urge incontinence.
The second category of treatment is surgical, which is the only way to cure urinary incontinence in one shot. The procedure commonly performed for stress incontinence is called the suburethral sling procedure, which provides additional support for the urethra.
And a sling is a small piece of mesh that goes underneath the urethra to keep it to hold everything up, to help keep you from leaking. It's very successful with up to about 70% of people being very satisfied with the procedure. In many cases, a patient may not leak after the procedure, but there are some people who, especially when they leak a lot prior to the procedure, it will not get them dry, but it will get them to a place where they can be a lot more comfortable with their life.
Once a patient receives a treatment that works for her urinary incontinence, she can stop worrying about every future cough or traffic jam. Now she'll just have to go back to hating colds and rush hour like the rest of us. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.